Hello and welcome to the Vaping Education Webinar. My name is Tim and I am the WebEx producer for today's webinar. It's now my pleasure to introduce Donna Jacobs. Donna, the floor is yours.
Thank you, Tim, and good afternoon, everyone. Thanks so much for joining us today. Welcome to the University of Maryland Medical System's Let's Talk About Health Community Conversation Series. As Tim said, I'm Donna Jacobs and I will moderate today's program. Let's Talk About Health is a series designed to increase awareness about important health topics, provide people with tools to help maintain and improve individual health, and improve conversations between patients and community members with their medical providers. Today, we'll focus particularly on education related to vaping. We're very fortunate to have two experienced health professionals from the University of Maryland Upper Chesapeake Health System with us today, and they are Christy Willits and Sharon Culbertson. Ms. Willits is the Community Outreach Program Coordinator at Upper Chesapeake. She's responsible for evidence-based and community health promotion programs, and she holds a degree in community health science from Towson University. She speaks frequently on vaping and other issues in the Harford County school system, as well as numerous community settings. She's been a part of the Local Health Improvement Coalition, serving as a member of the Chronic Disease Prevention and Wellness Work Group for many years. Ms. Culbertson, next slide, is a long-term registered nurse and member of Upper Chesapeake's Community Outreach and Health Improvement Department. She has extensive nursing experience in nephrology, especially dialysis at home and in center. She also serves as a facilitator for the diabetes support and smoking cessation programs at Upper Chesapeake. Before I turn the program over to Ms. Willits and Ms. Culbertson, a few additional housekeeping notes are in order. Albeit this conversation is meant to be interactive, albeit virtual, this conversation is meant to be interactive, and therefore, please feel free to type any questions that you might have in the Q&A, the question and answer box, not the chat. And we will respond to as many questions as are possible during the time that we have together. As Tim also said, this conversation is being recorded, and the slides and the presentation will be available to you in a couple of days, and I'll provide more information about that at the end of the conversation. And finally, let me mention what's here on this slide, and that is that with our Let's Talk series, we frame these in the context of Ask Me 3. And it's a teaching methodology that will help patients and community members grasp information related to health topics, and again, keep and hold on to the information that you may be provided by your healthcare professional. So it works like this. There are 3 questions. What is my problem? What's my main problem? What do I need to do about it? And why is it important for me to do this? So we're going to start today with our speakers giving you a hypothetical, giving you a scenario that'll suggest how you might use Ask Me 3, how you might use these 3 questions in talking with a healthcare provider. And particularly today, it will also illustrate and give you a bucket, if you will, for the information that you receive as the conversation goes along. So with that, ladies, let me turn that over to you.
Okay, well, thank you. If we could go to the next slide, please. So I wanted to present a scenario where you could utilize the Ask Me 3 questions. And for me, my main problem was my teenage son was caught vaping at school and subsequently was suspended. So that was definitely my problem. We went to the pediatrician and I really didn't know what we needed to do. So of course I asked that question to the pediatrician, what do I do? What do we need to do? And he said the first step, coming to the pediatrician, was a good choice. Have I talked directly to my son? Have I asked him questions in regards to what does he understand about vaping or nicotine? What does he understand about possible dependence to it? And then he also suggested that I talk to the school, so to see if there was any programs that they would have available. Now, why is this important for me to do? this? Well, for goodness sakes, it's definitely my child's health, his safety. I don't want him to be afflicted with any of these illnesses related to vaping or any potential future illnesses that he could get. And he definitely needs to stay in school. So these were a great way for me to go to my healthcare professional and to take charge of the situation so I could get my questions answered. So next slide.
So I'd like to sort of go back in history a little. I think any parent is going to need to be able to ask those questions, needs to educate themselves a little bit. So, and that's the purpose of this webinar today, is to give you some information and education. A little history about vape products. They came onto the market in about 2006, so about 16 years ago, still relatively new in the scheme of things. They marketed the products as a way to mimic a traditional cigarette, even calling them cigalikes. They touted them as a healthier option because they were not combustible. There was no flame needed to burn the tobacco, so no tars, which we ended up learning later, cause cancer and those kind of things. Leading causes of death, such as heart disease, cancer, and COPD, are all contributed to tobacco use. So the health risks of cigarettes were well known. So how could people resist the opportunity to use a healthier product? Very exciting. They were marketed also as a way to quit. If you wanted to come down off your, 3 packs a day of nicotine, vaping might help you do it, is what the tobacco companies said. Next slide. So then they started to have a little bit of fun with the product and the concept. So the companies went even bigger with refillable tank styles and mod style vapes, as you can see on the screen here. Customizable with the ability to make temperature changes to control strength of taste or hit. They do require some work. Consistent maintenance with some electricity and chemistry know-how is recommended for the device to remain usable and safe. Okay. Do most people know that when heated at certain temperature, a vape's solvent ingredients, propylene glycol and glycerol, can formulate formaldehyde? I didn't know that. And I only knew it because I did the research first, which I hope people today do thoroughly and accurately when they seek to try these products. Next slide. Then capsule or pod-based products came onto the market. Products like Juul, and many of us, I think, have heard about Juul. Notice how much this product looks nothing like a traditional cigarette. It looks very much like a thumb drive for a computer. So why would Big Tobacco decide to go from a small cigalike style vape to a large tank style version back to a small, sleeker, and more discreet style tobacco product? I think the key word there to me seems to be discreet, something that did not look like a traditional cigarette. Next slide. The basic parts of how the e-cigarettes work, and this is pretty much true of all the products across the board. They have a battery power source, they have an atomizer to make the heat, and they have e-liquid or e-juice in the product. The e-liquid is what contains the nicotine, the flavoring, propylene glycol, and glycerol, also called vegetable glycerin. And what happens is the battery activates the atomizer to get hot. It warms up the liquid inside of the tubing, and that creates an aerosol that is breathed into the lungs and then exhaled. Next slide. So let's focus on the pod products just for a moment, because they have a little bit of a different structure than the other e-cigarette products. They have nicotine salts, glycerol, propylene glycol. They have some natural oils, extracts and flavors, and substances to be determined. It also has benzoic acid, and that is very key. That differentiates. There's 2 products here that differentiate it from the other e-cigarettes. Benzoic acid is added to help mellow the harshness of the chemicals, to make it easier to swallow, so to speak. Nicotine salt also provides the same effect, and it delivers nicotine in a very high concentration. Nicotine salts are so effective in delivering high levels of nicotine that anyone can stay hooked just with a handful of uses. It's very concerning information for people who may have tried to use this product because they thought it might help them quit. And it's dangerous for those thinking about experimenting. with pod-based e-cigarettes, such as our youth. It's also worth mentioning that solvents, glycerol and propylene glycol, although we've heard of them being deemed food safe and used in cosmetics, they are never safe for inhaling into lung tissue. And that's very important because just because you see your body as one entity, it doesn't mean that all things entering the body are considered equal. Just know there are no nicotine-free pod-style vapes. When they have nicotine salts in it, there's nicotine. Okay, next slide.
So what exactly is nicotine? Well, we know it's a highly addictive chemical compound that is found in tobacco products, and this, of course, includes e-cigarettes. And using any tobacco product can cause addiction and make you want to keep coming back for more. How does nicotine work? Well, it's absorbed quickly into your bloodstream once you inhale it. It goes from your bloodstream then to your brain. And once it's in your brain, you have receptors in your brain that the nicotine attaches to. Once it attaches, releases a neurotransmitter called dopamine. And dopamine is the one that we call the feel-good transmitter. It makes you want to keep coming back for more and more nicotine. There also are other neurotransmitters that are released that actually remember where you were when you received that nicotine. And so that's what they think is cause for triggers, or what are the responsible for triggers. And yet again, more neurotransmitters that can help to raise your blood pressure or your heart rate. Now, here's the other problem with nicotine. It changes your brain chemistry. After a while, your receptors, they grow insensitive to that amount of nicotine, and your brain compensates by making more receptors and more receptors. This is especially true for people under the age of 25 because their brains are still growing. Now, the more receptors you create, the more nicotine you need to make them happy. And so then the more vaping that will occur. So next slide. The effect of nicotine on the body. Well, it has multiple effects on your organs in your body. As I already said, it can increase your blood pressure, your heart rate, it narrows your arteries, it can give you an increased risk for a heart attack or for a stroke, even heartburn, nausea, diarrhea. It also increases the risk for insulin resistance, mood disorders, and a risk for problems with the reproductive system. Next slide. Now this slide talks about the nicotine in pods. So let's take a look at this. Now a normal cigarette has about 10 milligrams of nicotine. But when you smoke a regular cigarette, you don't smoke in 10 milligrams. You get about 1 to 2 milligrams of nicotine. Now look at this image here of the Juul pod. A Juul pod contains about 41 milligrams of nicotine, which is actually kind of equivalent to 41 cigarettes. A fixed pod has 75 milligrams of nicotine, or equivalent to 75 cigarettes. And then the Sorin pod has 90 milligrams of nicotine, or 90 cigarettes. Now, if you were going to smoke, and if you were to smoke the equivalent of the Sorin pod, you really would have a hard time doing it because it would be so harsh to your throat. You would be coughing, and it would just be very uncomfortable. But because of those nicotine salts, the companies are able to add more nicotine to the product, and it doesn't have that harshness related to it. Next slide.
Okay. Let's talk about the clouds that are so popular. The atomizer heats the e-liquid, like I mentioned earlier, and it changes the structure of the liquid into an aerosol that the user inhales and partially exhales. Many young users say that the clouds made by vaping are just water vapor. Perhaps they look less dense than usual cigarette smoke, and maybe it doesn't linger around for long. A vapor is a compound that can evaporate. Think about hot water escaping from a tea kettle. An aerosol is a mixture of particles suspended in a gas and can contain many chemicals. Instead of just mixing with the air like pure gas, aerosols leave droplets. It sort of settles where it lays. It just kind of comes down and stays where it is. And that's why hairspray and aerosol holds hair in place. It's got that tackiness that just sits on the hair fibers and holds them still. You just imagine that for a minute, that aerosol doing that inside of your lung tissue. Next slide. Take a look at all the chemicals that have already been found it's been around 16 years, and they have found all these chemicals in vape aerosol. Many we already know cause cancer. You'll notice nicotine is listed here. Like Sharon said, nicotine is a highly addictive compound. It truly works like the key. It's going to unlock the door and it's going to let all these other toxins in. Next slide. And speaking of aerosols, the effect with third-hand vaping. First-hand vaping we know is direct contact. Second-hand vaping is if it's blown into your direction. Third-hand vaping is if it lands on surfaces and areas that you come in contact with. The aerosol poses a danger to people other than the one vaping, is what that sounds like. It remains on surfaces or even in surface area dust. And unless you dust surfaces every day, think about how that lingers around in your environment until you clean it up. Think about maybe if somebody vapes in your car and it stays on your fabric in your car until you actually wipe it off. These chemicals expose our babies, children, our elderly, our pets even to the chemicals by getting into the respiratory system through ingestion as well as skin exposure. Next slide.
Close the VPN. Okay, so now the health risk to a vape user, and just to reiterate, we know that there's irritation to the nose and the throat, and it can also irritate the layers that protect you from getting sick, viruses, bacteria. There's also aerosol droplets that leave that residue in your lung and makes it hard to breathe or put you at risk for some lung damages. I already talked about the damaging effect on your brain and the cardiovascular system with the arteries. And of course, the regular use may lead to the addiction or dependency. So next slide. The next slide, this is about bronchiolitis obliterans, or popcorn lung. And this is caused from inhaling a chemical diacetyl, which is used as a flavor enhancer, actually, and it's for artificial butter or to increase the sweetness. And it is found in fruit, dessert, and candy-flavored vape juice. Now, it's called popcorn lung because originally it was located in individuals who worked in microwave popcorn factories, and from inhaling the diacetyl, it caused their bronchioles, which are the little tiny tubes that go to your alveoli, problems. It caused a lot of scarring, and actually there is no treatment really for this illness other than transplant. So it can get so bad for that. And the problem is that it is found in many of our e-cigarette vaping flavors. And now another e-cigarette related illness is called EVALI, which stands for e-cigarette or vaping product use associated lung injury. And this was identified in about 2019 when a lot of people were showing up at the emergency room with pneumonia. And the doctors, when they were doing cultures, and they could not find out what type of bacteria or what type of virus. It wasn't being identified. And what they did notice as they took lung fluid samples, that vitamin E and THC, which is the compound in marijuana that makes you feel high, was located in these individuals in their lung fluid samples. The other commonality was that these were vapors. So at that time is when the CDC did step in and say you should not be using vitamin E as an addition to the products, and definitely not vaping for THC. So next slide. Regulating products. Now, here's a challenge. We know vape products and e-liquids are still in the process of being federally regulated. Each tobacco product manufacturer must send in an application for approval. And the FDA had created a deadline in September 2020, and then also another one in May of 2022. At this time, they incorporated the synthetic nicotine. Originally, synthetic nicotine was thought to be not related to this since it wasn't a tobacco nicotine, but it has since been included in. Now, at present, one brand of e-cigarette has received approval from FDA, and that brand is only allowed to provide tobacco-flavored e-juice. No fruit-flavored or no other flavors are approved. Now, when a tobacco product manufacturer sends in this application, the product has to provide the following evidence. Number one, it cannot encourage new use of a tobacco product by the public. Number two, it should decrease the use of combustible cigarettes in adults. And number three, risk and benefits to the population as a whole, including users and non-users. Now, the FDA received thousands of these applications, and they really don't necessarily have all the manpower to go through all those applications as timely as they would like to. So things are still under review for them. Next slide. And then when we look at vape safety risks, besides the obvious ones that I shared in regards to your health, there are other problems associated with using a mod type, and that is the risk for the battery to overheat and explode. And a large number of these vaping explosions actually occur in people's pockets, so causing damaging to their hips or to their legs. And what occurs is they put their extra battery in their pocket, not realizing they have change or coins in their pocket. That's going to make a connection with that battery and potentially could cause an explosion. And actually, about 80% of the injuries related to the battery explosion are usually found in that pocket area. Now, there are more devastating injuries, of course, that have also caused from a mod being either modified or changed. And the image we have here, this gentleman is, he had suffered a fatal injury when his device blew up in his face. And then there's this photo also of individual who's lost teeth and gum for having a mod blow up in their face. Next slide. Now here's a hard one, the long-term effects of vaping. It's so hard to say. We don't really know what the long-term effects are. We know there's a lot of different chemicals that have been identified, and many more are yet to be identified in vaping. And as we move forward, we know there's going to be regulations adopted to help increase the safety of this. But for right now, we just don't really have a handle on this. And the sad thing is people who are vapors, they have to be willing to be the guinea pigs to show us what's going to happen in the future. Next slide.
And what's awful is that not knowing what the long-term effects are, the companies just continue to market the products without us really knowing what the end result is. So let's talk a little bit more about marketing tactics by Big Tobacco. Next slide. Who is going to replace our old smokers? These folks have passed on, and, the average American now knows more about the effects of cigarettes and smoking. So many are teaching their young kids not to do it, not to use the product. So how is Big Tobacco going to stay in business? They have to come up with a different idea to boost their profits. Next slide. So they're going to advertise to teen and young adults because 90% of adult smokers started before the age of 18. As Sharon mentioned, those receptors are very active before the age of 25, and that is why they're able to form an addiction so early on. History has shown more than one time that young people get hooked on nicotine early in life and become lifelong users. The industry will deny this, of course, and say that their products are for adults only, but there are indicators that suggest otherwise. Next slide. For instance, this is an example of a piece of an ad. It was actually more of a video type ad, but we took the still shot of it as an example. This is an ad created by Fix Labs, the creator of Juuls. They claim the target audience for the lab is for the adult cigarette smoker. What do you think? I see, a very young model with bright colors, wearing stylish, youthful clothing. And I'm thinking this is maybe not for your typical adult smoker who may be trying to quit or cut down on their tobacco use. It looks very intriguing for a younger audience. That's what I think. Next slide. Not to mention the advertisements, but the companies also sell accessories, very trendy product and accessories to personalize e-cigarettes. So characters, gems, decals, that brings a lot of attention within young social circles, don't you think? I mean, I think that when a group of young people get together, they like to compare and show, what their products look like and how they trick them out. I'm not sure that accessories are needed to help current smokers quit. And I might be encouraged to continue to get all the latest goodies if they did offer something like that, but I think I will stick with my phone cover options instead. Next slide. All right. All right, so flavorings in e-cigarettes are another tactic that the companies use. It makes them even more appealing than plain old tobacco flavored products. And there are roughly 55,000 flavors available. The trendy flavors are a successful marketing strategy and allows an e-cigarette user, especially the new ones, especially the young ones, the ability to consume nicotine without the boring and possibly unsavory tobacco taste. Word of warning though, flavors add an even higher amount of toxicity due to those chemicals within the flavoring. So you're not only getting the nicotine and other solvent sort of chemicals, now you're getting flavoring chemicals as well. So do you think folks that smoke traditional tobacco need to vape boom boom pop flavor in order to reduce their nicotine consumption? It's all very suspicious. Next slide.
So this will be our video, and what we're going to see is how an e-cigarette industry, what they have to say about these e-juice flavors. This is a clip of California Senator Barbara Boxer asking an e-cigarette industry representative about this topic.
You sell your products in cherry crush and vanilla flavors. Cherry crush. How can you sit here and say you're not marketing to children?
Senator, it's a good question, and flavors.
What's the answer?
The answer is the average age of a cherry smoker is in the high 40s. But
That's the head of Blue e-cigarettes.
Are you marketing to children?
no, I am not.
But the
So thank you for sharing that. So the question is, are they marketing to the youth? What do you think? Cherry Crush. I mean, it seems to me that perhaps it
Boom
is.
boom pop.
Yep. So next slide, please. Now, this is another misleading advertising yet again. And what it is, if you take a look at this jewel box, you'll see that it states 5% strength. And so it's a small number, and it says nothing about what 5% strength of what. And in this case, what it's talking about is it's a 5% strength of nicotine, which is a very strong dose of nicotine. Actually, 5% is about 50 milligrams per milliliter, or in this case, 41 milligrams per milliliter. Currently, more than 3/4 of the brands sold in the United States have a nicotine level greater than 4%. We know the higher the nicotine, the more the more potential for addiction. E-cigarette companies are only able to add this 5% strength related to those nicotine salts. If we did not have those nicotine salts, we would not be able to smoke this much of a strength or vape this much of a strength. It would be too harsh to you, and you would be coughing incredibly. As a matter of fact, Canada and in Europe, the e-cigarette nicotine level cannot exceed 2%. I already said higher nicotine e-cigarettes have driven the surge in sales in recent years. It creates the higher the nicotine level, the greater the addiction. So if you could go to the next slide, please. And here's where this comes in. So the more nicotine equals more vaping, which potentially can lead to smoking. And they did a study in 2017 of some young adults who were smoking or vaping, and they found that people in that age frame who were vaping with this larger amount of nicotine were 4 times more likely to start smoking a combustible cigarette after about 18 months of vaping. So next slide.
So we're asking you to consider every day the impact of your choices, or have a discussion with your child about the impact of the decisions they may make. Things to consider: many teens would not use a traditional cigarette, and like Sharon just said, they ultimately end up using a device they never wanted to start with in the first place. How do you think traditional cigarette smokers felt when they learned about the harmful health effects caused by cigarettes that were being covered up by the tobacco company? How do you think an e-cigarette user would feel if 10 years into the future they learned that vaping were just as harmful as traditional cigarettes? How do you think advertising is playing a role in your teens' choices to use e-cigarettes and vapes? And how are we going to stop it as a community? Okay, next slide. We've listed here some wonderful resources. I know they look like just simple one-liners, but if you open each one, it's full of multiple resources for you to get education, cessation options, what are options for youth. Here in Maryland, MD Quit Also provides a wonderful teen cessation program. Truth Initiative, the company through American Lung Association, offers a youth text program. So, you know, this information should be able to help you go to your provider and get more information, and they can provide you with linkage to how to get help within the community. It will give you the information on what questions to ask, okay, and the information you need to know. Next slide. Additional resources. There's so many. We typically we recommend following the .org or .edu or .gov. You will occasionally see a .com. You just be leery of some of those as far as they may be offering something that you don't want because they're commercial. But there are some very good programs out there. So these are more resources for you. Next slide. These are some of the resources we use today for our presentation. The FDA, the American Lung Association, CDC, Stanford University has a wonderful toolkit, which a lot of these slides are based off of. And they're not just for educators in the school system, they're also for parents. They have games and other sort of tools that are very effective with young people to try and encourage them to learn more about the product, at least get educated so that you could make the choice. And also Maryland Department of Health Center for Tobacco Prevention and Control is now the name for the MD quit that I mentioned. Okay, next slide.
Ladies, thank you very much. This is frightening, I would say, and I think it's not something that's sufficiently in the public domain, and so I'm glad you brought this forward. I don't think people have as much information about vaping as they should at this juncture, but I would also say equally frightening is what you've described as the lack of research yet into the long-term effects. You know, and I understand your point that we might find ourselves later, years down the road, finding out that the impact on health is as negative as regular cigarettes have been, and then it's so late. It makes it hard to have a discussion, I suppose, with people that you want to see. So let me remind those who are watching, you can drop your questions in the Q&A. There are a couple that I'll start with now. So how do you know, are there signs to look for that someone may be vaping? They may be hiding it. You know, with traditional cigarettes, we've heard there are purple lips or dark fingers or something. Are there signs to look for? What should a parent know?
One of the signs that you could look for is actually, it's not the traditional smell that is normally associated with smoking, but they may have a sweeter smell on them. Also, disappearing. Additionally, we noticed that there was a decrease in vaping during our pandemic experience related to the fact that the kids weren't able to get the product, and they also didn't want their parents to find out. So I believe that any type of secretive behavior is something that as a parent or as a guardian that you would want to look into with the child.
Perhaps even a cough that doesn't go away. Frequently they'll come into the school nurse with a cough or whatever, and that if that goes on and it's abnormal, that should be looked at as well.
Thank you. So you've spoken about the addictive impact of nicotine and the amount of nicotine in e-vaping, but so is it more difficult, as difficult, easier to stop a vaping habit than it is to stop cigarette smoking? And do you use the same methods to stop vaping as you might?
That's a really great question. And I'll tell you, they're still doing a lot of research on this to determine how can you stop vaping. I was reading in reference to nicotine replacement therapy, which is our normal product that we would suggest for individuals to stop smoking. Now, as I shared earlier, the nicotine is so much higher, they're not sure that the patch or the gum is going to provide the same sort of relief to an individual who is vaping, since the nicotine is more advanced. Additionally, kids, you can't get that just right over the counter for a person under the age of 18. You can get nicotine replacement therapy for them, but it comes through their physician. But that's another area that they still really don't have the answers for. And a lot of the treatments or the suggestions are more of quitting like cold turkey, so to speak. And that can be great challenges for individuals. As I shared, you have a dependence on it for your brain, but also you even have a dependence on the triggers. It's very challenging.
It may take 7 times for a cigarette smoker to quit, right? I
Mhm.
mean, it could
Right.
very well take a little bit longer for a vape person
Oh,
who uses vape.
wow. Okay. And so I think you're describing an addiction to, this is leading to the question, to vaping. Does the addiction happen slowly over time? We hear about controlled substances where, you may become addicted once or twice after use. Is this different than that?
Well, it's a stronger nicotine amount, so you can become addicted quicker, but everybody's different. One of the funny things is when I was talking about the receptors being created in the brain, a lot of individuals before the age 25, they get more receptors, and so the addiction is really strong. It's just like when you start smoking or vaping, you may only vape a little bit, but then as time goes by, you have to vape more, vape more, vape more. Well, some people, though, in their brains, they don't create additional receptors. Those are the people that have much more success at doing the cold turkey stuff. So it really depends on the person and what their physical makeup consists of.
And some end up dual using because the nicotine from the vape isn't enough and they end up using cigarettes as well. So everybody's different.
Sounds like Russian roulette, really, you know.
Yes,
Yeah.
absolutely.
So we only have a few more minutes. What's your best advice to parents about how to have a conversation with their teens or even perhaps younger children about vaping?
Yeah, I mean, having 3 young children myself, I tend to be very honest with them and open, and I don't judge them for the things that they say. I come to expect that they're youthful and they're going to have ideas and want to experiment with things. But having that open dialogue, being able to speak to each other calmly and openly is really a main factor. And plus having a parent or an adult get the education for themselves so they can help the child as well and using resources available, like we mentioned.
And if you go to the American Lung Association, there is the Truth Initiative, and they have a whole program about talking to your teen and actually what to say, how to say it. Don't be surprised if you hear your kid has tried it. So that's really good information for, I think, for parents to take a look at. Prepare yourself ahead of time that you have some information available to you.
Being aware of what the root cause is for even trying it, I think that's also how maybe they're being bullied at school. And that's, something that you didn't even pick up on because the vaping thing happened first, so digging a little bit deeper, I think is helpful.
Well, this has been great. And I want to say thank you as well. You mentioned the Lung Association. I want to say thank you to the Heart Association, which has helped us put the program together and online with us today. The Maryland chapter, as well as St. Joe's, that have both been helpful. Is there anything else you want to share with us before we conclude? And I give a couple of other notes. You've done a great job.
I am really grateful. Well, I am very grateful to have this opportunity. This is something that I feel really strongly about with nicotine addiction in general or nicotine dependence. And I truly hope that as a community, we can move forward with our children to provide them with the information they need so they can make a better choice. So I thank you for allowing this to help educate others.
Well,
Yes,
thank
there
you.
are deep cessation opportunities available, such as at for Chesapeake, we offer a cessation class here, and it's worthwhile taking it. I don't know if people are hesitant to get into a class because of fear of, the unknown, but it's worthwhile checking into it or at least talking to someone. So that's what I'd say.
Right. And the Heart Association has lots of information available too for folks. And let me just say thank you and wrap up with a couple of other slides, share a little bit more information for all of you. Next slide, please. So again, this is part of the Let's Talk series, Community Conversations from the University of Maryland Medical System. In 2 days or so, you will be able to see these slides and the presentation again, if you'd like, by going to the site at ums.org/letstalk. And there you can also see any of the other presentations that have taken place month to month here. Next slide. We will, we don't do these during the summer. So we'll resume in September, and our first topic there will be sickle cell. We'd love to have you come back and join us. And as well, in the interim, let me mention the next slide. Our companion series is on mental health, and it's called Not All Wounds Are Visible. We have several topics coming up. To start off a sub-series on June 30th, we'll be talking about tender loving care and how to care for people who've suffered trauma. There are several methodologies for that, so we'll give an overview of all three and then go through each one over the course of the next several months. And related to that, on July 20th, we're doing a session on mental wellness in a continued stressful environment. Lots of things going on, COVID, political unrest, gun violence, etc. So we'll be talking about all of those. So I think that's the last slide. Let's see. I just want to say thank you to the presenters very much, and thank you for all that joined us today. Have a great day, everyone.